Hello, my name is Jan Hopler. Thank you for taking the time to view this video. As the director of the Washington State Mental Health Division, I believe it is essential to provide services to mental health consumers which meet their needs and individual circumstances. Therefore, it is important for us to know who we are serving. Sexual orientation is important information that is appropriate to know. Too often, service providers assume their clients are heterosexual. Identifying oneself as gay, lesbian, or bisexual can be very difficult. I hope that this video can help you gather information on sexual orientation in the most respectful and accurate way possible. On behalf of the Mental Health Division, I thank you for the services you provide.
The purpose of this video is to aid providers in the collection of data regarding the sexual orientation of consumers using publicly funded mental health services in Washington State. My name is David Wertheimer. I work for the King County Department of Community and Human Services and as a therapist in private practice. The Washington State Data Dictionary lists sexual orientation as one element to be collected. This video will focus on lesbian, gay, and bisexual people. Gay men and lesbians are individuals whose primary physical and emotional attraction is to people of their own gender. This is often called affectional or sexual orientation. Bisexual individuals are attracted to people of both genders, sometimes with varying intensities. The Department of Social and Health Services is currently working with the following data set related to sexual orientation. Entries in the data set are also available to indicate that a client was not asked to identify his or her sexual orientation, that the client is a child under the age of consent, or that the information is unknown. You may have noticed that there are no references at this time to transgendered people in the data elements. That is because this is primarily an issue of gender identity rather than sexual orientation. The Department of Social and Health Services is not currently collecting data regarding services to this population. Identifying as gay, lesbian, or bisexual is a very personal experience. Simply asking the question opens the door for that conversation.
I first started to discover that I am a gay man in college at a large Midwestern university, and I was having a very difficult time in some of my classes. And fortunately, I knew that there were some folks I could go talk with, so I went and talked with some friends and some teachers, and they recommended that I speak with other folks also. At that time, I realized I am a gay man and started to deal with my own internal feelings, my own losses about being a gay person in a private religious institution at the time. It was a difficult process for me, and I see coming out and being a gay man as a lifelong process of coming out, integrating who I am, and being myself in the world.
Most difficult part of coming out for me was telling my parents. And even though once I told my mother, it was like, okay, we're not prejudiced, so now that we've talked about it, we don't have to talk about it anymore. So that was the hardest part of coming out for me. Telling my friends, most of them already knew. Telling my siblings, my sister said, well, so? We've known that for years. But I have been lucky in that aspect because of who I am, that it was easy for me to come out to my friends because they liked me regardless.
The difficult set of choices that I had to make when I came out were really around the heterosexual lifestyle that I had set up. I was married, had 3 kids, and the youngest had not been around very long when my wife at that time and I decided to separate. I think for me, leaving a secure, society-accepted lifestyle behind was the most difficult part.
Implementation of the sexual orientation data element in 1998 now allows sexual minority consumers enrolled in community mental health centers to be counted and heard so their service needs can be more effectively met. This has created a dilemma, however, for many mental health providers who are unsure about how to ask a consumer's sexual orientation in an affirming and inoffensive manner. First, let's take a look at how not to acquire this information.
Okay, fine. So do you have a wife?
No.
A girlfriend?
No.
Oh, dating?
No.
So you're just enjoying being single, huh?
Well, no, I'm not. That's part of the reason why I'm here.
Oh, I'm sorry, I didn't think to ask you. Are you a homosexual?
Yeah.
So what do you think of the TV show Ellen? Okay, well, let's talk about what really brought you here. Are you unhappy at work?
As you can see, it can be very awkward bringing up a subject to which our society has attached so much stigma. There can be many reasons for this discomfort. One reason is that heterosexism is prevalent in our society. Simply put, this means that often most of us assume that someone else is heterosexual and that other sexual orientations are unnatural or somehow wrong.
Sometimes when it comes to counseling, that kind of thing, it can be a little strange because you never know what the counselor's personal biases are, and some of them may even try to, do a kind of reparative therapy type of thing without even meaning to, as a way of fixing your problems.
I had a problem of high school counselors either not believing me or blaming me for problems that I was having with kids in the high school. So I did finally end up leaving that high school, changed to a different high school, the one I'm in now, and everybody there knows that I'm gay, and everybody is very accepting, so I'm very lucky.
I had a difficult time the first time I went to therapy, and I drank before I went to therapy. That gave me the courage to go to therapy. And when I went in, I did not tell him the first couple times I went in, but before each session I also had a few beers, so I was drinking before each session. And then when I decided I was going to tell him, he convinced me, or he was trying to convince me, that it was just a phase, that I really wasn't lesbian, that I just didn't have any experiences other than that. And so he was going to help me get through that phase in my life. And I listened, and I did a lot of things, and I tried things, and it was a difficult time for me because it was a degrading type of experience. And when I finally realized what was happening, I stopped going, and until a friend of mine convinced me to go to another therapist. And it took me a while before I made the call, and once I did make the call, I sat and drank all afternoon before I went to her to give me the courage to tell her that I was going to be forthright of who I was. And I did. I walked in and who I was, and it was like, okay, and why are you here? So she was very compassionate and understanding, and she didn't judge me for who I was. She just let me be, and she helped me work through a lot of issues with the prior therapist and some other issues with understanding that it's okay to be me and it's okay to be gay.
Another reason for discomfort with this topic may relate to personal, cultural, or religious values. It's important to remain aware of how your values may hinder the therapeutic process, and to remember to put client needs first. You may want to seek special consultation to help you work with gay, lesbian, and bisexual clients. And if necessary, you may need to transfer the client if your personal values conflict with the therapeutic process.
I remember having difficult time with my medical care at one point when I was receiving medical care at a large health maintenance organization, and I asked my primary care physician if he would be okay dealing with my health needs as a gay man, and his response was, yes, I can deal with that. And then that was the end of the visit. During the next medical appointment that I had with him, he said, his first question to me after I had a cold was, when was the last time you had an HIV test? And from then on it was downhill about my medical care. I ended up choosing going to another medical care provider because of that, and now I'm careful to screen and usually will ask people who've had good experiences with their health care providers before I do go seek medical care somewhere.
And finally, it may be difficult to raise the issue of sexual orientation due to the very private nature of sexuality itself.
Self-identifying as gay or lesbian really opens up a whole new aspect with healthcare services. I can speak from the experience of having directed a mental health center and being open and gay with my staff and having them come to me and ask simple questions such as, well, I've got this individual in treatment who's gay. What do I call him? And I said, well, what about his first name to start with?
When you're gay and lesbian and trying to come out to an employer for a new job, even for healthcare, some healthcare providers, it's a difficult situation to do that when you're not sure of who you are and you're not giving that opportunity to be who you are. And it will be, excuse me, it will be hard for, it was hard for me to actually, if someone were asked me to question, I would go all around it at a certain time in my life. Now if they ask me, I'm comfortable with who I am.
Once you come out, you can never go back. There are some people who they'll only be out to a few people, or they'll only be out in like a certain aspect of their life, or not at work, that kind of thing. But I think that, I don't know, dealing with feelings of frustration and paranoia and secrecy all the time, once you come out, it's such a liberating experience. I don't understand why you wouldn't want to just, be out to everybody.
Again, it is important to understand your own value system and to work ethically within your areas of competence to meet the needs of the consumer. Now, let's take a look at a scenario that shows a therapist asking about sexual orientation in a sensitive and respectful way.
Now, we want to make sure that you get the best possible services here. So our agency tries to tailor services specific to individual needs. And that includes services appropriate to your understanding of your sexual identity. Now, I want to ask you a couple of questions about your sexual orientation, but if you get uncomfortable, please let me know and we'll just move on. Okay?
Okay.
Do you identify yourself as primarily heterosexual, gay, or bisexual?
Gay.
And do you feel like you have the support of your community and your family?
Mm-hmm. Yeah.
As you can see, the therapist gave the consumer the option of disclosing or not disclosing his sexual orientation and included the option of heterosexuality in order to make the question more applicable and acceptable to everyone. Something else a therapist or an agency can do is provide an environment that acknowledges acceptance of diversity. Since gays, lesbians, and bisexuals seek out signs they will be accepted, visual clues that show support are extremely helpful. This can be done by displaying symbols that represent the gay community. These include pink or black triangles, rainbow flags, posters, or other signs of diversity that welcome all persons, including gays and lesbians. Another way to show acceptance is to have written materials appropriate to this population available at waiting areas, gathering spaces, and therapy rooms. The handout you received includes a bibliography for the materials shown here.
Okay, Matt, we'll see you in 2 weeks. And don't forget, if you need to cancel or reschedule, it's not a problem. Just let the secretary know about 24 hours in advance.
Okay. I just wanted to let you know that I really appreciate you asking me about being gay. I saw that you have a lot of stuff around your office, and that really put me at ease to talk about that.
Oh, good, good. I'm glad you feel comfortable here.
Yeah, I wasn't sure if I should bring that up right off the bat, so I'm glad you asked.
Good, Matt. It was nice to have met you.
Yeah, you too.
As with all minorities, there may be no issues with the consumer's sexual identity, and being gay, lesbian, or bisexual may not be part of the presenting problem. However, asking questions about a consumer's background conveys acceptance and improves your ability to more thoroughly conceptualize the person's difficulties and develop useful treatment approaches.
When I first came out, I started going to a counselor, and first thing she said, okay, you're gay, now what do we do now? It wasn't, trying to change me or trying to get to the root of that. Why was I gay? It was, this is who you are. You seem to be okay with it. Now, where do we go from here?
My advice to healthcare providers to offer good quality services to any individual, especially to gays and lesbians, bisexuals, would be to understand where you're coming from as a healthcare professional and realize that where you're coming from as a healthcare professional and where you might be personally with any values or judgments or mores are two totally different things. The focus as a healthcare professional should be on the individual in treatment for their well-being, and knowing yourself well enough to be able to determine what's a value judgment on your part and what are in the best interest of the clients is probably the most important thing.
The data being collected about sexual orientation will be used to gain information about the number of sexual minorities being served in Washington State without identifying specific individuals. Setting an appropriate atmosphere to gather this information will result in a greater understanding of client needs, increased opportunities for individualized service improvement, and system enhancement. Thank you for taking the time to review this presentation. For further questions or information, contact the Mental Health Division or any of the following organizations.